exercise is good. If you don't want to continue spending money, in the hospital, or you don't want to start giving doctors your money, just exercise your body. And you thank me later. Morning Safari it is. Now we want to go deep. Usually after the exercise, we go into the world of health. This time we're having it in full scale. What are we looking at this morning? Of course, we want to explore one aspect of the health issue, and that's one thing that people really are scared of. And if you talk about HIV, or you talk about any other kind of ailments, or diseases, people or those who are the experts will tell you it is better to have even HIV than this one I'm about to talk about. Diabetes is on the rise, and the prevalence is something that is very alarming. But before we meet our guest in the studio, let's go for this background report and we'll be back in the studio.
Diabetes mellitus is increasingly affecting millions of people in Nigeria, prompting healthcare experts to stress effective management strategies to curb complications and improve healthy living of many Nigerians. Diabetes could be noticed in the body system with the following symptoms, such as excessive taste, frequent urination, unexplained weight loss, blurred vision, etc. Having observed this, medical expert speaks on the causes and its management.
Diabetics is a metabolic disease that is caused by alteration in the effect of insulin in the body. And based on this, it is divided into three. The type 1 diabetes, the type 2 diabetes, and the type 3 diabetes. In type 1 diabetes, the insulin production is deficient, and it's not enough to control the sugar level in the blood. While in type 2 diabetes, the insulin production is enough, but the body is resistant to the insulin that is being produced. So in effect, that insulin does not have any effect on the sugar concentration in the blood. So when the blood is analyzed, you find out that there is increased insulin and increased sugar at the same time in the blood. Diabetes generally can run in the family. It's have some hereditary traits, and therefore one should be a little bit careful, especially if you have the traces in the family. It's usually could run in the family. People with diabetics should take less carbohydrate food. They should reduce the intake of carbohydrates. Then it must be important that you take your dinner before 7 every day. This goes round to, it's a form of control and prevention too. Because even if you have not gotten a diabetics, don't eat beyond there. In fact, we said beyond 6 o'clock. But people may find it difficult, especially people that are working class, that go to the offices and come back around maybe 5 or 4 before they could prepare their food. It might be too difficult to maintain 6 o'clock. But what we are saying is that don't go beyond 7, even if you are not diabetics. Because eating and going to bed without any form of exercise before you go to bed can predispose you to growing weights. And as you are becoming obese, then you are moving close to being a diabetic patient. My final message to the public is that one, we should go for medical tests almost every time, at least to detect, because diabetes will not announce when it's coming. So when you have, before it rises to a very dangerous level, you will have picked it up, and it's going to be very easy to control at that time. Number 2 is that exercise is very, very important. We should not live a sedentary life. Number 3 is we should watch the rate at which we take carbohydrates. and most of this fast food that are available now in our environment, you can see that the onset of diabetics could be traced, increase in diabetics could be traced to the onset of fast food that is growing around our environment. And majority of people now, they prefer to take fast food, and that's why the rate of diabetic is seriously increasing now.
Too much of sugar in the body and also too much of carbohydrates in the body causes diabetes. So I've thought about it, and I will start taking precaution on what I eat, and not to eat late at night, and also not to smoke, not to drink. So I'm going to take all this precaution and make sure everybody around me works in good health also by explaining this to them.
Diabetes is caused by too much sugar, intake of sugar, like starch foods. Too much of taking carbohydrates. So when you take too much of carbohydrates, you have diabetes. And so to reduce diabetes, you have to balance diet. You have to eat balanced diet. Then you go away from carbohydrates, anything sugary, go away from them. Then you monitor your eating habits, what you're supposed to eat and what you don't supposed to eat.
According to the experts, diabetes is not curable, but if patients complies with doctor's prescription, one is expected to live a healthy life. Diabetes requires proactive management to prevent complications. With early diagnosis, healthy lifestyles, and expert care, diabetes can be managed effectively.
Welcome back from that background report. And now we have with us on set in the studio Dr. Nasiru Sani. Dr. Nasiru Sani is an endocrinology. I hope I pronounce it correctly. And he's from University of Ilorin Teaching Hospital. Thank you very much for honoring our call this morning.
Thank you, sir.
We are glad to have you join us. Now, from that background report, I'm sure viewers have been informed of, yes, I'll say a little on the peripheral level, but we have to dig it deeper. If we mention diabetes, it looks like something, I'll say, well, I have a headache, or maybe it's just like any other, like if you say malaria or any other thing. So what is diabetes and why do I have to care?
Thank you very much. Good morning, viewers at home. Diabetes mellitus, I have to qualify because there are different types of diabetes.
Really?
You can have diabetes insipidus, then diabetes mellitus. The one we are talking about this morning is diabetes mellitus. Okay. In diabetes mellitus, if I have to define it medically, we say it's a metabolic disorder of protein, carbohydrate, fat.
Metabolic disorders
of protein, carbohydrate, fat. That is characterized by hyperglycemia. I will break it down.
Okay.
Hyperglycemia, and it occurs as a result of relative or absolute insulin deficiencies or resistance of the body to the effect of insulin. In a nutshell, let me say what I've said is that diabetes is a disorder that is a problem that has to do with the way the body handles food. The majority of our food, they are carbohydrate, they are either carbohydrate, they are protein, they are fat. So, and when someone has diabetes, he has a disease that did not allow his body to make use of those food I've mentioned. So it's a disorder that has to do with the way the body handles food generally. And this particular disorder, it's occurred because the body is not producing one particular hormone that we refer to as insulin, or the body produces the hormone, but the body does not respond to the effect of the hormone, or a combination of these two. So in all, diabetes is what? A disorder of how the body handles food.
Thank you so very much. That's clear enough. And I want to say a big thank you to you for, enlightening me, myself, and of course some viewers there. I know if you mention hepatitis, we have hepatitis, I don't know, A, B, C, D, E, F, GH. I don't know if the alphabet is going on. But for diabetes that we are discussing this morning, I never knew that it has categories. Now, the hormone that you mentioned that actually, my attention quickly ran to that, and that's insulin. Is it that breaks down at a particular point in time, and what could have been what could have caused that? If actually it breaks down, then what could be the reason for that?
Yes.
Because you said insulin is it an hormone in the body?
Secreted by an organ called the pancreas, the beta cells of the pancreas.
Okay.
They are the one that produce insulin. The pancreas in Yoruba is what we refer to as amon.
Amon.
Yes, so it's ẹran amon.
This case is
ẹran amon, as in when you are saying ẹran amon in the body, is pancreas.
Yeah, I get. Yes. Yeah. So what leads to the breakdown of this pancreas you mentioned, or the insulin? Let's go medical.
Yes, pancreas produce insulin. This insulin has been found to be the major hormone that is affected with diabetes.
Okay.
And this can lead us to classification of diabetes, because we look at how does the diabetes come about. We could have type 1 diabetes mellitus, in which there are some soldiers of the body. We have soldiers that protect us against foreign invaders. But in this particular situation, the foreign invaders are seeing the pancreas, the organ that produces insulin, as a foreigner. They don't recognize it as self. The soldiers of the body, they are there to attack soldiers or anything foreign that want to attack the body. But this time around, they are seeing the body as a foreigner, so they start attacking the pancreas. So in that situation, they will destroy the pancreas completely. So that is what we have in type 1 diabetes. There is autoimmune diabetes. The body soldiers, they are the ones that turn back to the pancreas and destroy the pancreas.
Okay, so everything now, the soldiers, the pancreas, the insulin, those things that make the food in the body to go to their different places and work well for the body, all are internal.
Yeah.
Now, I know exo and endo. Exo is something that is external. Endo is something that is internal. You are an expert when it comes to, that's why you are endocrinologist. Okay, so what symptoms what signs can?
Before we go to sign,
okay,
you asked me about the pancreas.
Yes.
I've just told you about one type of diabetes, which is type 1 diabetes.
Okay.
In which the soldiers attack the pancreas and destroy the pancreas.
All right.
We now have the type 2 diabetes, which constitutes more than 90% of people who are living with diabetes. In this particular situations, the body does not respond to the effect of insulin. What is the effect of insulin? Insulin acts like a key that opens the door for the body to make use of food. So when this key is not there at all, we have type 1, or is there but is defective. So the body is not able to open that key. So there are plenty of food, the body is not able to make use of it. Suffering in the midst of abundance. So that's type 2 diabetes.
Suffering in the midst of abundance.
Yes.
Okay.
So in type 2 diabetes, major thing that we know is that there is resistance. The key is not functioning well. There is resistance. And it's one that accounts for 90% or more of people who are living with diabetes. Then we now have type 3, which some people call gestational diabetes. In gestational diabetes, a woman who is not previously known to be diabetes prior to pregnancy now develop diabetes during pregnancy. Then after delivery, many of them return back to normal within 6 weeks of delivery. Then we have the secondary diabetes, which you can see maybe type 4 now, secondary diabetes, which is diabetes that occur because of a particular disease condition or because of use of medication. There are some drugs that when one uses them, one can develop diabetes. And there are some disease conditions that can cause diabetes. Now the symptoms, diabetes can be asymptomatic. That is, people who have diabetes may
What do you mean asymptomatic?
Asymptomatic means that the individual who has diabetes may not even have any symptoms.
Oh.
Especially type 2 diabetes, it could be in the body for upward of 10 to 12 years without individual realizing that he or she has diabetes. Nothing, no symptoms. Just going about it or alive normally, no problem. But As he or she is going about, normally no problem, that individual is working towards complication. All those complications of diabetes, they are developing without even realizing. And for those who have symptoms, what we call 4 P's of diabetes: polyuria, polydipsia, polyphagia, polyneuropathy, in which the individual may be having polyuria, excessive passage of urine, large quantity urine frequent. Polydipsia, excessive thirst.
I'm feeling uncomfortable.
Insatiable thirst. Just want to drink more water, more water, more water. Polyphagia, eating, despite eating so much, they are feeling unsatisfied because the food that they are eating is not getting to their cells, it's not getting to their tissue. It's just in the blood, move around the blood, then get out of the urine. As I said earlier, suffering in the midst of it. Then some of them may have neuropathy, in which case they may have abnormal sensation, peppery sensations in the leg. That may just be the symptom that some have. But some may even present with complication of diabetes. Is that how they present with sudden blindness? Yes, diabetes can cause sudden blindness. Diabetes can cause stroke, heart attack, kidney failure, loss of erectile power. Some men lose their erection because of diabetes. A wound that refuses to heal that may result in amputation. Diabetes is the commonest cause of non-traumatic amputation. That is, when you see somebody who lost his or her limb, if that amputation is not due to accident, it's more likely to be due to diabetes.
Now, I get this, I think general, this, I don't know if it is medical. When people say, oh, diabetes patients mustn't sustain any injury of any degrees, that it doesn't heal. Is that true?
Wounds, especially people who have diabetes that's not well controlled, their wound takes long time to heal. And if they have a foot ulcer, which occur because of the complications, because in diabetes we have neuropathy, we have vasculopathy, micro and macrovascular. If all those complications have occurred, their wound may not heal. I've seen a patient who have wound for upward of 6 months, non-healing wound. 6 months.
That's
a year. It is
let's talk about management now, because time is not our friend today. Let's talk about management. How do for those people who are patient, or I don't know, should we say carrier?
Management here, for those who are listening to us, please check your blood sugar. You need to first of all know that you have diabetes.
Okay.
Before you know how to treat it. So check your blood sugar. Do you know you can do it by checking your blood sugar? Go to test. Go and check your blood sugar. See a doctor. Check your blood sugar. So if you have been diagnosed with diabetes, there are 3 or 4 basic ways of managing. Start with lifestyle modification. You need to look at your lifestyles. There are some lifestyles that are not encouraged.
Like what and what?
Yes, people who have diabetes, one, you are not supposed to be having a sedentary lifestyle. You should be exercising. You should walk more, exercise more, and eat healthy food. Then we don't have specific diabetic diet. Like people will say when you are diagnosed with having diabetes, don't eat this, don't eat that, eat a kuru, a kara, moi moi. No. The diet of a diabetic patient, the diet of somebody living with diabetes, is a balanced diet. Our emphasis is on the quantity. Eat small, eat healthy, eat fruit, eat vegetable, exercise. So lifestyle, exercise. Do at least 150 minutes of exercise in a week. And that 150 minutes of exercise should be divided into 3 or 4 times. You should not go more than 2 days without doing exercise. So if you trek for 45 minutes or 1 hour, alternate day, in 1 week, you get 150, fine. Then medications. Medication could be oral. It could be oral that we take, or it could be insulin. Insulin, we have exogenous now. We can get insulin has been synthesized in the lab that can be given, especially for those who have type 1 diabetes.
Okay.
They are not producing insulin at all. They need insulin for survival. Without giving them insulin, they are going to die. If you give them insulin, they survive. I've read about a woman who was diagnosed at the age of 10 in 1932 as a type 1 diabetes. And when I read about her, she was above 80 years. She had lived with diabetes for more than 70 years. She had used insulin several times a day for more than 70 years.
Wow. Well, you've said so much things that would get people to be conscious of their health. You talk about check, go do medical check, especially a sugar level, and then go discover whether you have it or not. And then you spoke about exercising your body and the rest of that. Now we have a little time to look at the management and of course the society generally. We believe that for someone who has diabetes, some people might stigmatize against them. Some will believe, is it something that is transmissible? Is it?
Diabetes is not a transmissible disease. It's not a communicable disease. You cannot take care of people who live diabetes and develop diabetes. No.
Okay.
We have some risk factors. There are some risk factors, and we classify them into two. Modifiable risk factor, that is risk factor that you can do something about, and non-modifiable risk factor. The one that you cannot do anything about, your age. As you are going above the age of 35, your risk of diabetes is increasing. Your family, if a parent have it, you are likely to have it.
It is hereditary.
Yes, some of them are transmissible. If a parent have it, you are likely. Then you have the non-modifiable, that are the most important one: sedentary lifestyle, obesity, poor diet, cigarette smoking.
What do you mean sedentary?
Yes,
lifestyle?
not moving around. People just
sitting down
all the time.
Okay.
So obesity, alcohol consumption, cigarette smoking. So unhealthy diet consumptions. All these, they increase the risk of somebody. Hypertension itself. If you have hypertension, you are likely to have diabetes. So watch out.
Thank you so very much. It's been a very intense on health side, conversation with Dr. Nasiru Sani, an endocrinologist from UATH. Thank you so very much for the voice. Some other time we'll bring you to throw more light on these gray areas.
Thank you, sir.
Thank you. Money Safari is the show, and this time we will go on a short break, and don't go nowhere because we've got other discussion that will channel our ways, our intention, our efforts towards nation's development. Stay